tied up on the rope.
Good morning, guys.
Good morning. How are you doing today, sir?
How's this horse doing over here?
She's doing fine so far.
Fantastic. We're gonna go somewhere else. So we're here at the Oregon State University of Commercial Services in Managua. There's a team of 38 people, 9 veterinarians, and the rest are all students. My God, look at this guy. Good morning. We got dogs of every size, shape, and color over here. Here's a goat. So she looks like she's lactating.
And we'll have a vet come over to do the pregnancy evaluation now. So to see when her baby will be.
Good morning. How are you today?
I'm great.
So tell us a little bit what you're doing this morning.
This morning we are doing wellness exams on pigs, goats, horses in the large animal clinic.
So you're using the student, he's helping you out with, what is he doing with you?
The students are very important as translators because not many of the veterinary students are fluent in Spanish, and so for us to communicate with the owners of the animals, it's very important and very, very helpful that we have a translator that can both express the questions and the concerns that we have, but also to ask the owners questions so that we can gain more information and are able to make accurate diagnoses.
How about if we set up a goal, and within the next 10 years, in 10 years, Oregon State University veterinary students will be fully bilingual. Every single one that arrives.
Wonderful.
Won't that be great?
Wonderful.
Let's talk to our politicians back in Oregon to see if we can beef up the school system over there so it's not decrepit when it comes to bilingual abilities.
You know, there are more and more Spanish classes for both high school and college. Of course, we run into the same problem that you run into. They are losing funding for foreign language classes in the United States, and so it might be more difficult rather than becoming easier to have bilingual students.
But the whole country, the United States and Canada, is no longer competitive because the jobs are moving somewhere else, and you can't chase them.
They are moving somewhere else, and the goal is to adapt and to become more of a service-based economy because some of the manufacturing jobs are moving elsewhere. But
look, Intel is down the road in Costa Rica. But you need to speak Spanish if you want to follow Intel's jobs in Costa Rica.
Right.
Okay, well, thank you very much. And what is your name?
Laura Lynn.
Laura, well, thank you very much. Let me keep on going and to interview some of the students over here. Okay, so tell us a little bit about yourself. Where are you from and what are you doing over here?
I am from Canada.
You're from Canada?
Living in BC at the moment.
Okay.
And coming down to help out with the clinic and mainly helping out with the wellness exam.
Okay. Are you a student?
I'm a veterinarian.
You're a veterinarian?
Yes.
Okay. So, and what is this young lady over here doing for you?
This young lady is helping translate so that I can get histories and learn about the animals, what the problems and concerns are, and also helping me to let the owners know what we're going to do for the animals.
And what is your name, my dear?
My name is Helen.
Your name is Helen? Okay, very good. So it's critical for us to communicate in Spanish and in English, right?
It is extremely critical, and we really appreciate you translating for us because without the translators, it would not be possible.
Okay, beautiful. Maybe we can write a grant in Canada and in the United States so we can improve our English abilities.
Yes, that's
okay. Or you guys can come wrapped up with the language already. Let's give ourselves 10 years. That's what I told the other students.
Yeah.
10 more years, and Oregon State University students will be wrapping it up in Spanish and in English.
That's a great idea.
Okay, that'll make us obsolete. Okay, beautiful. Thank you very much. Good morning, good morning. I'm doing great. How about you guys? Tell us a little bit about what you're doing right now.
Well, right now I'm doing a 4-way snap test, and it is I test for Ehrlichia, Anaplasma, heartworm, and Lyme disease. And so we're able to tell which of our animals that are going to surgery are sick and may have bleeding problems in surgery.
Have you gotten any with Lyme disease already?
We've not had any positives for Lyme disease this far.
I don't think it's endemic of the area.
I don't think so.
Yeah.
The test comes with it anyway, wrapped up. Okay, well, thank you very much.
One over here, right? Yes. Okay, and we're still just waiting for blood work.
Good morning, guys.
Hello.
How are you guys doing today?
Good.
Tell us a little bit of what you're doing right here with all this needles and charts and paperwork that you're doing.
All right, well, this is the induction section.
Hold on a second, let me move over here.
The induction section of the clinic. So this is where we get the medications ready to give to the animals so that they can be anesthetized for surgery. So we just draw up everything that the animal will need along with their antibiotic and their pain medication so that this patient basket can follow them into surgery.
Okay, well, thank you very much. And you're from where?
I'm from Oregon.
Hey, another person from Oregon. Oh my God, it's Oregonians left and right over here.
Everywhere.
Thank you very much. What are we doing to this little fellow over here?
He's getting a catheter. He's totally sedate. See how
Okay.
he's just lax.
All
We're going to
right.
get a catheter. We're going to clean his arm.
Okay, very good.
Disinfect it.
And tell us a little bit, where are you from, my dear?
I'm from Spain. So
You're
de
from
España.
Spain?
See?
Oh, okay. But you don't have in English, you don't have an accent like if you're from Spain.
You don't have it either.
Well, it's a long story. Well, so you're gonna pass him to this table next door?
He's actually going to stay here. We'll anesthetize him here.
Okay, so
Once we get the catheter, we'll put the drugs through the vein and make him go to sleep.
good. Thank you very much. And what is your name?
Ana.
Anna. Okay. Beautiful. So we got people from Canada, from Spain. Okay, gracias. Thank you very much. Some of the students. Good morning, guys.
Morning.
I'm doing a little film over here as a promo to promote the veterinary care in the island of Ometepe.
Okay.
So I'm just gonna, if you don't mind taking a peek over here. And we have like 3 students here. Where are you guys from?
Oregon State University.
Everybody's here from Oregon State University. But how about you, my dear? Where are you from?
I am from Vancouver, Canada.
Okay, so we have 2 Canadians here.
2?
There's
Okay.
another lady over there.
Yes.
And how long you been doing this?
I've been doing this 15 years.
And you work in the United States or in
Work in
Canada?
the United States in Hillsboro, Oregon.
Okay, well, thank you very much. And what is your name?
My name is Donna.
Donna
Anderson.
Anderson. Thank you very much, Donna. Good morning, good morning.
Good morning, Alvaro. How are you?
We're doing great. I'm just checking out on the clinic and doing a little film so we can put it on YouTube. And this is a little cat we're trying to anesthetize. Wow.
He's actually anesthetized already. He's been neutered. We're just trying to give him an IV injection of cefazolin, which is an antibiotic. It's
Okay.
a little hard to hit their veins because they are anesthetized, so their blood pressure is not what it would be if they were awake. And Vicky's not actually even started vet school yet, so she is doing an amazing job.
Okay. So Vicky, I know a little bit about yourself. You're from Peace Corps worker, right?
That's right.
Okay, beautiful. And how about you, my dear? Tell us a little bit about yourself.
I am originally from New York, but I've been living in Portland since I graduated from vet school in 2002, and I work with cats and in a private practice with cats and dogs, and I also do shelter surgery. This is my first time in Nicaragua, and I love it.
Okay, beautiful. And you from what university you're from?
I came from Cornell.
From Cornell University. That's in New York, isn't it?
It's in New York. I'm a New York native.
Okay, very, very, very well. Okay, well, thank you very much, and keep on
you.
trekking, okay? And look at all these guys. They're all waiting and learning. This is the recovery area. How are you today?
Good.
So what do you got here for us?
We have 2 cats here. They both got neutered.
Okay, and then just recovering.
This one is recovering, and I'm using him as a heater
for this smaller one who is also recovering, and his temperature went down, so, and this one's went up.
Oregon State University, huh?
Yes.
So this place becomes like an Oregon State University veterinary school.
It does.
In 10 days.
It does, yeah. It's amazing how much I've learned so far, because it's being able to apply what I've learned in school to actual animals versus learning it in a book and not really getting hands-on experience. So I remember more when I hear it and do it versus just hearing it.
Right.
So.
Okay. And what is your name?
My name's Nancy.
Nancy, well, thank you very much. Have a wonderful day, okay?
Bye.
You're looking at this microscope.
We're doing blood smears, so we're looking at white blood cell counts and red blood cell red blood cell morphology, see if they're pale with anemia, and then we're also looking at platelet counts to make sure they're not going to bleed in surgery, and hopefully we're going to see some actual parasites.
Is this for a donkey, a dog, or cat, or?
This is a cat that's going, actually I'm not sure if it's cat or dog, we just have S for small or L for large, so we don't actually see the animal, we don't really know. We just know it's small or large.
Okay.
So it's a small animal, either a dog or cat, that's going to be going to surgery.
Okay, so this is the wannabe lab that we have.
This is our diagnostics section.
Okay, it sounds very fancy.
Yes.
A completely different setting than what you're used to back home, isn't it?
Well, the humidity and the heat are making things a bit harder with some of our calculators won't work, so we have to figure everything in our head. It's harder.
Okay, you have to do math. You have to go back to elementary school, huh?
We're really doing simplistic estimates here.
And how did you end up with us over here in this island in the middle of Lake Nicaragua?
Well, I learned about the Oregon State students through a e-newsletter. I'm from Florida, and I just always would have wanted to try doing some international veterinary care, and thought it would be great to be able to.
So which area of Florida are you from?
South Florida, Broward County.
Okay, so you're from Fort Lauderdale area?
The suburbs of Fort Lauderdale, Pembroke Pines.
Okay, very good. Well, thank you very much. Have a wonderful day.
You're welcome.
Y esta perrita. This is a little bitch over here. She's tiny. Oh boy. She's mad. Good morning.
How you doing?
Good.
Okay, we're just trying to take sharp points off of the outside edge of the uppers, the inside edge of the lowers.
Okay, let me take a peek with the camera there. Oh wow, incredible. So you're almost done?
No, the first cheek teeth on the bottom here are a little bit too tall. So we're going to bring them back down and make them look like the rest of the guys.
Okay, and how long does it take you to do this procedure?
We're doing it in a teaching mode right now, so we're taking about an hour.
Okay.
But normally I can get them done in about 15-20 minutes.
Oh wow. And where are you from?
Oregon City, Oregon.
Okay, so there's another Oregonian here. We're loaded with Oregonians, huh?
Yeah.
Beautiful. Thank you very much.
Welcome. Okay, so I got the points.
Okay.
Off of that one, the inside edge of the lowers, but this lower 6 is too tall. So I'll try that. So you're going to hold the tongue over here on this side, and you're going to take the wearing surface of that one down. Okay, and we do this with the McKee. Try to stay at the same angle that it's already. And this one's too tall. Okay. So you're going to stand in the middle, tool, so you're outside here. Okay, so then the angle is going to be tipped to the outside like this.
Okay.
Okay. So I'll work on that. Nope, you pull the trigger.
Yeah.
Follow the same angle as everything else.
This is almost like a carpentry job what we're doing on the teeth. Wow, dental work. So this is a modified industrial tool that is just for carpentry, and then you modify it to feed.
They call it a sawzall or reciprocating saw, but I've modified it to help hold these big shafts that I can put in the horse's mouth.
Okay, very good.
So the motor gets tired instead of my arm.
Right, I know.